We are delighted to have all of you here today. Earlier this morning, I heard the Honorable Prime Minister referring to this meeting as a historic meeting. The Caribbean has always valued health, and indeed in their articulation in the Nassau Declaration, we gave life to our belief that health is wealth, and that without health we can't have any development. This has been a long-standing notion in the Caribbean, and we have never failed in terms of investing in health. Today, you will hear of many of the initiatives we have taken to improve the lives of our people. But today we are proud to also introduce to the world the Caribbean Public Health Agency.
Today, we are engaging partners in a discussion of the future of one of the most impressive and important undertakings. One that may be deemed an investment in the health of the people of the Caribbean and could well make this event a landmark in the annals of our CARICOM regional integration process. When CARICOM heads of governments approved the establishment of CARPHA in its final version at their intersessional meeting in March this year, it marked a significant step in the history of public health development in the CARICOM region. According to the records in the CARICOM Secretariat archives, the idea of an integrated public health agency is neither new nor novel.
We will now hear a message from Trinidad and Tobago to be read by Ambassador Williams, the ambassador of St. Kitts Nevis.
CARPHA is an impressive network, an impressive undertaking, amalgamation of 5 public health entities into an integrated agency. The ambassadors in the CARICOM caucus here in DC recognize and are sensitive to the importance of health as a vehicle for development. We are from time to time involved with Paho in briefings with the CARICOM Secretariat. Dr. Greene as recently as 2 weeks ago met with us to inform us of CARPHA. We have had input from the World Bank and IDB and other agencies which help to have us appreciate the importance of health for development. I'm very pleased that the partners, so many partners, are here committing themselves to this important Caribbean initiative. We, as a caucus of CARICOM ambassadors, will follow up as appropriate, make the necessary overtures, and do whatever we can to ensure that the process of establishing a comprehensive public health agency, amalgamating the 5 agencies in the region, will become the success that it needs to be. And we'll work diligently, not just with Paho and with the World Bank and other institutions here, but whomsoever we think will benefit this process. It's our pleasure to be a part of this process. We will stay invested in it and just welcome you here. Thank you very much.
This is really the first time that we are having a meeting like this, you know, to show what has been the progress so far, particularly after the historic decision by the heads of governments to endorse the creation of CARPHA. Although we have had all along the process in different moments and opportunities and gatherings, the possibility and the fruitfulness of the discussions and exchange and keeping all of you engaged in the process of defining what CARPHA should be, testing the idea and also putting a lot of concrete actions into it and estimates and so on. So I think that at this point in time, many or most of you are very familiar with the proposals that are going to be discussed. And therefore, the main purpose of this gathering is really to get your suggestions and proposals, but also your commitment and your engagement to move this process forward.
At both the CARICOM, that is the regional, and the OECS sub-regional levels, heads of government recognize more than ever that in creating institutions, there is need to carefully consider all of the options that are related to the viability and also to cost effectiveness. However, the CARICOM heads of government, as we've heard, have already fully endorsed the establishment of CARPHA as a most effective mechanism for achieving health and development in the region as a whole. This, of course, was done after a full review of the recommendations and proposals that have been spawned more than a decade of debate, research, feasibility studies, and policy discussion regionally and internationally on the future and the role of public health in our Caribbean region. CARPHA has therefore emerged, despite all of the other pressing needs, as a very important step in the development dynamics of the Caribbean region.
As a result of the series of consultations, as a result of the series of investigations, as a result of the comments by experts in public health, experts in management, experts in public policy. I call politicians experts in public policy, but they were ex-politicians. And they arrived at this fundamental conclusion. And the fundamental conclusion, as a result of all this analysis, was the Caribbean needed to establish a public health agency to provide a collective response to the current and emerging public health problems of the Caribbean. And in that resolution, in that declaration, there is the essence of what CARPHA is going to be: an agency, collective response, the current problems and the emerging problems of the Caribbean. In order to give form to that final resolution, the final conclusion, the heads of governments were approached, and the proposal was put to them that we may consider three options. One, a single health agency, CARPHA. Two, there may be 5 of these institutions should continue to be administered by CARICOM or some outside entity and maintain the status quo. And the decision of the heads of government that option 1, creating a single health agency, CARPHA, was the appropriate one. And they made that caveat that we should not think of CARPHA as just shoehorning 5 agencies into one. We should think of CARPHA as an agency that combined the best of those institutions, looked at the gaps that they no longer filled, and merged all of these together in a single institution that gave a collected and integrated response to the current and emerging health problems of the Caribbean.
As I said, we are here this morning seeking your support for the establishment of a single regional public health agency which has a vision of a Caribbean in which the health of the people is promoted and protected from disease, injury, and disability, thereby fostering the wellness revolution enunciated in the Port-of-Spain Declaration, which Sir George spoke about and also Prime Minister Douglas spoke about earlier.
Canada values its relationship with CARICOM and Paho. Given our commitment to global public health, we see the establishment of the Caribbean Public Health Agency as an opportunity to respond to the public health needs of the Caribbean community. CARPHA will provide an opportunity to address existing gaps in responding to common public health challenges across the region. The recent spread of the H1N1 flu virus underlines the importance of joint cooperation in public health. These factors have underlined the importance of a heightened new role for the Caribbean Public Health Agency once established. The Public Health Agency of Canada has been supporting CARICOM in the creation of CARPHA for approximately the past 2 to 3 years in both technical and policy advisory roles. Canada has also provided, as mentioned by Minister Ramsamy, financial support to the CARPHA project management team. In addition, given that the Caribbean Epidemiology Center, CARIC, will be the cornerstone of CARPHA, the Public Health Agency of Canada is also currently working closely with Paho to strengthen the laboratory capacity to the CARIC in Trinidad and Tobago in the interim until CARPHA is established and beyond.
Certainly, I would like to reiterate the words of our director this morning. I think that she was very clear this morning in terms of Paho's continuous commitment to the establishment of the Caribbean Public Health Agency. As you know, Paho has been involved in this process from the beginning, even dating back to prior 2002. And in Dr. Greene's presentation this morning, he rated the long-standing process which has been going on in the Caribbean. And Paho certainly has been a part of that, in that iterative process, and therefore certainly Paho is very pleased to see the evolution and the birth of this new agency, the Caribbean Public Health Agency. And as Paho, we certainly stand committed to supporting fully the Caribbean Public Health Agency. Within our sub-regional program budget, of course, clearly delineates that this is funding to support the sub-region. And certainly we are going to be supporting CARPHA in terms of ensuring that our Paho strategic objectives are fully implemented through our sub-regional programs, and working with the agency as we have worked with CHRC, SEHI, and CRDTL at presently. We will continue to support, through our technical cooperation, the new Caribbean Public Health Agency during its birth, gestation, childhood, and adolescence.